In today's video, I'm going to talk about the importance of emotional intelligence in nursing. This is a very important topic to talk about because over the course of an ordinary shift, every nurse might experience a conflict or two. Conflicts may cause from differing opinions, a challenging family member, personality clashes, and even just general stress. So dealing with conflict can be uncomfortable, but emotional intelligence is the key to remaining calm and achieve better outcome. Emotional intelligence also improves communication so that nurses can cope more effectively with conflicts. Most importantly, when nurses apply emotional intelligence, it leads to even a better patient experience. Stressful situations happen in every workplace, and the message employees often get is to keep emotions in check. Though most would agree that bottling up emotions is not necessarily a healthy behavior, and so emotional intelligence takes a different approach and has become a highly sought after skill set with employers. Intelligence quotient or IQ may influence how well people perform at work, but emotional intelligence may be a better measure of success. And so there are many definitions of emotional intelligence. That is, correctly identifying emotions in oneself and others, using emotions to reason, understanding emotions, managing emotions. And so by putting all these abilities together, we can describe emotional intelligence as being aware that emotions can drive our behavior and impact people positively or negatively, and learning how to manage those emotions, both our own and others, especially when we are under pressure. Emotional intelligence is very important in nursing, and this can be the most valuable asset to nurses because nurses have a variety of roles and their daily activities may vary widely. But a nurse's primary goal is to provide high quality care. Empathy is the main ingredient. In nursing, empathy plays a very important role in establishing the patient trust. Major benefit of this trust is that patient may be more likely to adhere to their care plan. Discussing the connection to emotional intelligence, we can put it simple and say that without emotional intelligence, you can't have empathy. Preventable medical errors have been caused by lack of emotional intelligence related to communication failures. So emotional intelligence is linked to patient safety, and communication and emotional intelligence are clearly linked. Studies have shown that nurses themselves benefit from improving emotional intelligence in that they are able to improve physical and emotional wellness, improve their retention at their workplaces, as well as having lower levels of burnout. How can nurses boost their emotional intelligence? Developing emotional intelligence is similar to learning a clinical skill. Just as nurses can improve clinical skills such as IV line insertion, they can boost emotional intelligence with practice. I have few suggestions on how to go about it. You need to perform a simple self-assessment. Take time for self-reflection following a challenging situation. Ask questions such as, how did that go? How was I feeling? What made me feel that way? Was I able to listen without judging? Was I able to understand the other person's point of view? It's also good to try simple mindfulness techniques, like just taking a few slow breaths, which can reduce stress. You can also learn and practice assertive communication. This is a non-threatening way to communicate information, ideas, and beliefs to other people. Nursing is a stressful occupation, there's no doubt about that. And rather than let the stress impact the quality of care to our patients, emotional intelligent nurses can check in with their own emotions before seeing patients so that stress does not get in the way of the patient relationship. Emotional intelligence can also help nurses tackle tough conversations. And as patients advocates, nurses may sometimes disagree with other healthcare providers' decisions. However, fear of conflict may make it difficult to speak up. And a high level of emotional intelligence can equip nurses with the skills and confidence they need to communicate concerns and create mutual, respectful relationships. Emotional intelligence may seem just like another buzzword, but for nurses, it touches nearly every aspect of their work, from improving team function and patient outcomes to creating a healthier work environment. Emotional intelligence can be a game changer. I have a bonus tip. Nurses with emotional intelligence may find they leave the stress behind when they head home, which is a healthy practice. Who wants to carry stress home? Home is meant to have peace and good therapy. This brings me to the end of this video. Thanks for watching. Be sure to subscribe, share and comment, and let's practice emotional intelligence.